Hello. This presentation covers falls among older adults and utilizing exercise as a falls prevention intervention. So we know worldwide the amount of individuals over the age of 60 is growing. And this is due to the baby boomers who were born in 1946 to 1964. So a research study by Gershwin states that the older adult population is expected to increase from 688 million, this was in 2006, to almost 2 billion by 2050. Okay, so that's an increase from 688 million from 2006 to 2 billion by the year of 2050. So falls in older adults are already a major public health concern, and this is only going to increase as the population of older adults increases. Okay, so what is a fall? Why am I describing what a fall is? We all know what a fall is, but do older adults realize this? So it's important to have a definition because older adults, again, often do not have, they understand what a fall is, and they have different views on the falls. So if they do have a fall, they will not tell anyone because I didn't hurt myself. So that's an example of maybe what they think a fall is and isn't. So a fall is when I fall and I get hurt. So if I fall and I don't get hurt, it's not considered a fall. Okay, and so older adults are also more likely not to tell anyone because they don't want to let their family members know, or a friend, or a social worker, because they may get put into a home, a nursing home, a skilled nursing facility, assisted living facility. And this loses an opportunity to prevent future injury, if they do not tell us whether or not they fall. So a fall is an unexpected event in which the older adult lands on the floor, ground, or level. This is whether they have an injury or not. Okay, so why do older adults fall? So we know as we age, our joints become a little stiffer, we're not able to move as good, our muscles become a little weaker, some individuals lose their muscle strength more than others, and also our neurological system can be impaired. Okay, so with a normal gait and balance requires freely moving joints. Our muscles can contract at the right time with the appropriate strength, and our visual field is not impaired. Okay, so as we age, again, we experience all of these changes. And these changes, in combination with other risk factors, can increase the likelihood of falls. And the risk of falling also increases with the number of risk factors that are present. Okay, and the study that was posted with this shows that a patient with 4 risk factors has a 76% chance of falling. Alright, so an older adult who falls may experience pain. They can be hospitalized depending on whether or not they have an injury. They may need surgical intervention if they fall and break a hip or hurt their shoulder or whatnot, break a bone. They may need admission to a nursing home. If they have surgery, they're going to have to be put into a nursing home to get therapy. They may experience a decreased overall and functional ability, poor quality of life, and fear of falling. So just a couple facts. Falls are the leading cause of injury and death by injury in older adults, 65 and older. Falls have a huge financial toll. So for older adults, falls is expected to increase as the population of older adults increases. We all know that. And it could reach 67.7 billion by 2020. That's a huge amount. All right, moving on to our risk factors. So we're going to start with the extrinsic risk factors and move to the intrinsic risk factors. Okay, so extrinsic risk factors. Environmental hazards. This would be poor lighting, slippery floors, or uneven surfaces. May need to remove the rugs from the home. Make sure all cords are pushed back to the side, away from the middle of the floor, so it will not cause a tripping hazard. All right, Footwear, very important to have a textured grip for the shoes. Don't need to wear any shoes that don't have a good grip on the bottom. And you'll see this especially in skilled nursing facilities. They really try to make sure that the residents, especially at night, have on textured socks if they're going to wear socks, or have on slippers they can slip on to go to the restroom, because a lot of falls happen at night. Okay, they need to be roomy for comfort. Now, not too big, because being too big can make the older adult fall. They need to be thin and flexible. Clothing need to ensure that it's not too big. Don't have baggy pants on, because that could cause them to trip and fall. Any appropriate walking aids, maybe their cane is not at the right level that it needs to be at, so assistive devices. All right, now we're going to move on to the intrinsic risk factors. So we have history of falls. This can be a risk factor. How often are they falling? What time of the day are they falling? Is this a pattern that keeps happening over and over? Our age, gender. So actually an older adult, women tend to have more falls more often than men. Are they living alone? Or is their spouse deceased? Are they living with family members? Does their living arrangement need to be altered a bit? Ethnicity, medications, such as benzodiazepine, they have been associated with an increase in hip fractures and night falls, and this is as much as 44%. Chronic medical conditions, this would be COPD, depression, arthritis, and cognitive deficiency. So this, research shows that cognitive deficit has been associated with an increased risk of falls. And it's also reported that residents in a skilled nursing facility who are diagnosed with dementia fall twice as often as those with a normal cognition. And then you have visual impairments as a risk factor. So cataract, glaucoma, macular degeneration, all of these contribute to risk of falls. Foot problems can be a risk factor. Example of foot problems: bunions, toe deformities, ulcers, deformed nails. All these cause pain when walking and can increase the balance difficulties. Also neuropathy, you need to watch. Whenever they lose the feeling in their feet, that can cause falls as well. All right, and then we have muscle weakness, gait instabilities, and balance deficiencies. And these are actually all three of the most common intrinsic risk factors for falls in older adults. All right, so for individuals who are at a high risk of falls, there's some actions that need to be taken listed here. So we need to ask about history of falls. How often are they falling? The older adult will need an assessment of functional ability. Okay, we need to review their medications and their medical history. Do they have chronic conditions? What medications are they taking for this? What are the side effects from the medications? Can it alter their cognitive ability? Can it alter, their balance? We need to review all of these, because it could be just a tweak in medicine, in the medication, that could help reduce the risk of falls in the older adult. Okay, we need to perform gait assessment. Are they shuffling their feet? Is one leg lagging behind compared to the other? We need to have a physical and visual exam. Assess their vital signs. Is their blood pressure up too high? Is it too low? Cognitive evaluation. This would be for dementia, using the mini-mental examination. Examine the individual's feet and footwear. Very, very important for diabetics as well. If they are getting sores on the bottom of their feet, they can't feel that, or someone with neuropathy. Make sure footwear is not too big and that they have the grip on the bottom. And also, home safety evaluation is very, very important. Alright, so using exercise for falls prevention. So exercise can help modify the three of the most common intrinsic risk factors that we just mentioned, which were muscle weakness, balance, and gait instabilities. So in the literature review by Sherrington and colleagues, which is posted online, they state that exercise as a single intervention seems to be the best approach to falls prevention. Okay, so there is a lot of research that shows multifaceted interventions are helpful, but Sherrington and colleagues found that exercise as a single intervention seems to be the best approach compared to their research. All right, now we're going to move on to best practice recommendations. So, exercise must provide a moderate or high challenge to balance. So, just sitting there and doing some knee lifts or some toe raises, if it's not challenging the older adults' balance, then it's not going to be as helpful. So, challenging the balance could be done by reducing the base of support. So, standing up tall, standing side with both feet side by side, close together, or you can put one foot directly in front of the other, called tandem stance. Okay, we want to the movement of the center of gravity, so we want to control of the body's position while standing. So you could have an older adult stand up and reach side to side, maybe reaching down for an object. So you want to transfer the body weight from one leg to the other, or step up on a block, step back, step side to side. How are they doing with that? Get them to practice on that. Okay, and then exercise must be a sufficient dose to have an effect. So it is suggested in the research article that exercise should be undertaken for at least 2 hours per week, and this can be a mixture of group or home-based exercises. All right, ongoing exercise is necessary. We all know that this is true, and that the benefits of exercise are lost rapidly when we stop exercising. It's so hard to build up that strength, that momentum, and work on your balance, and then you can just lose it so fast. So falls prevention exercises should be targeted at the general community as well as those at high risk for falls. So not only focus on those who have more risk factors and maybe who are falling, but also focus on those who are not, to avoid, to help them avoid becoming one of those high risk fallers. Falls prevention exercise may be undertaken in a group or a home-based setting. Either one has been shown to be recommended. So walking training may be included in addition to balance. So we really want to make sure that we focus on the balance during the exercises. But walking can be included, but it's not recommended for individuals who are at a high risk. So they shouldn't do any kind of brisk walking programs if they're at a high risk of falls, which makes sense. And also, too, if they are doing any kind of walking, we need to ensure that they're on a whether they're going to do a walking program outside or inside or on a treadmill, we need to make sure that someone is there with them and ensure that the area is safe, especially if you're outside walking. And also, too, with treadmills, because sometimes the older adult may not be familiar with a certain treadmill because all the buttons are different and many accidents can happen, whether you're on a treadmill or outside walking on a trail. Alright, so strength training may be included, but to be effective, the strength training needs to overload the muscles by providing an amount of resistance. So you can use a resistance band or you can use a dumbbell. And so this ensures that an exercise can only be done 10 to 15 times before muscle fatigue. Alright, and lastly, exercise providers should make referrals. So it's important that everyone works as an interdisciplinary team. They communicate with each other and just let each other know, like, hey, I've noticed this. She's not as strong as she used to be. Maybe talk to the physical therapist and the family just to see what's going on there to prevent the fall before it happens. And at home, that's something we can look for in our grandparents. If something's going on, maybe call their doctor or maybe ask them politely. They may not want you to, but if you could go to the doctor with them, or if anyone does go to their doctor's appointments, go ask, give them that information of what you're noticing. Alright, so to the conclusion. So with the increase in the amount of older adults, and like I said, mainly due because this baby boomer generation coming in, reaching retirement age, the need for effective fall preventions are so important. And falls have a devastating effect on the older adult, and not only the older adult, but also puts a burden on the family members and the healthcare system. A huge financial burden because if an older adult falls and they break a hip, well, then they need surgery, they need medications, they need hospitalization, they need rehab. All of it just starts to add up. And then the need for screening and assessments for fall risks are, again, vital, very important, need to be top priority. And just to conclude, that research does show and confirms that exercise as a single intervention can prevent falls.